This is the skills validation for Soap Suds Enema. There are many different types of enemas. Today we're just going to be reviewing the Soap Suds kind. So first we do the first 5. I'm going to wash my hands, identify my patient. Hi, my name is Samantha. I'm a nursing student at HAC. Can you please tell me your name and date of birth? Okay, and do you have any allergies? Okay. Your doctor has ordered a Soap Suds Enema today, so I'm going to help get that procedure started. I would ensure patient privacy with a bed towel and pulling the curtain, and I would make sure that they're safe throughout. So we have our enema bag with our warm water in it. You can test the water to make sure it's warm, a comfortable temperature on your wrist. So we've done that, and we've added our soap into that. This is hanging 12 to 8 inches above the patient's rectum. We can actually change that throughout the duration of while we're administering the enema. We would just talk with our patient. If they're having a lot of abdominal cramping, we can lower that, and that could relieve some of that. A little bit of cramping is to be expected. If they're letting us know they have severe pain, we would want to stop the enema immediately. Okay, so we have this 18 inches above the patient's rectum. The patient's going to be positioned on their left side. And we do prime the tubing to get so that liquid is filling that. So we would just open the clamp, and we can let that drain into a receptacle, and then we would close that again until we're ready to go to the patient's bedside. So you lubricate the end of the tubing 2 inches. The patient's on their left side. You would insert the tubing 3 to 4 inches into the anal canal towards the umbilicus. I'm going to insert that, and you can unclamp it at that point so the enema solution does start to drain. You would, again, just to let your patient know to tell you if they're having a lot of pain. If they're having cramping, you can adjust the height of the bag. And you'll go until either the bag is empty or until the patient tells you that they're not able to hold anymore. Okay, so the patient has informed me that they're not able to hold anymore. We would dispose of our equipment appropriately. You can position the patient on their back, and you would instruct them to to retain that as long as they're able to. It might only be a few minutes. They may be able to up to 10 minutes, and they would call you back in immediately as soon as they needed to expel that. You can have them on a bedside commode or a bedpan, and you would let them use that appropriately. And you would wash your hands at the end of at completion of it.